Obsessive compulsive disorder, or OCD, is a mental disorder that causes repeated and unwanted feelings or obsessions and actions or compulsions. Anxiety is one of the most common symptoms and can lead the individual to believe that if a task is not completed, something bad may happen. The cause of OCD is unknown. There is evidence that genes have a strong role in developing the disorder. If the disorder starts in childhood, it is more likely that other family members will have OCD than if the disorder starts in adulthood. It is thought that OCD is the result of things humans did when they were evolving. There are 4 DSM diagnostic criteria for OCD. The person has to have obsessions, compulsions, or both. The DSM defines obsessions as thoughts that happen multiple times that the person does not want. The person has to try to get rid of the thoughts. The DSM defines compulsions as actions done multiple times because of an obsession. These actions are done to reduce the stress caused by an obsession. The obsessions or compulsions take a lot of time or cause lots of problems in the person's life. The symptoms are not caused by a drug or a different medical problem. The problems are not closer to the problems caused by other mental disorders, such as an anxiety disorder or body dysmorphic disorder. So moving on to therapy. Behavioral therapy and cognitive behavioral therapy are used to help people with obsessive compulsive disorder. The therapy works by making people be in places where they have their obsessive thoughts. They are then made to not do their compulsion. Over time, the person becomes used to the place or things that causes them to have their obsessive thoughts. An example of this is someone who is afraid of dirt, having dirt put on their hands without being able to wash it off.
Medication. The medicines that are usually used are called selective serotonin reuptake inhibitors, or SSRIs. These medicines work by stopping a chemical in the brain called serotonin from working. This causes the obsessive thoughts to happen less. In adults, SSRIs are used for people with moderate or severe issues. In children, SSRIs are used after or with therapy for people with severe issues. If SSRIs do not work, it is possible for a doctor to give someone with obsessive compulsive disorder antipsychotic medicines. Doctors may use both medication and counseling for those with the disorder, and they find that this approach works best.
An example of counseling is cognitive behavioral therapy, in which obsessive thoughts are identified and replaced with more realistic thoughts.
There are many misconceptions about obsessive-compulsive disorder. One of these is that OCD is just about cleaning, hand-washing, and being a germaphobe. However, OCD is manifested differently in different people. In fact, only a proportion of individuals with OCD are afraid of germs or have compulsions related to keeping themselves and the world clean. Common fears or obsessions in people with OCD include fear of germs or contamination, fear of committing a sin, and fear of harming themselves or others. If you or someone you know suffers from OCD, make sure you get help.